Imagine this. You have a great evening outdoors. Maybe you get a tiny tick bite. You barely even notice it. A few days later, you eat a burger, a perfectly normal meal, and then 4 hours later, you're in the emergency room struggling to breathe.
It really does sound like something out of a sci-fi movie.
It does. What if a single bite from a tiny arachnid could just fundamentally rewire your immune system, making you violently allergic to your own dinner?
Well, that's the reality of alpha-gal syndrome, or AGS. Some people call it mammalian meat allergy, MMA for short. And it is essentially an acquired allergy to red meat and really any product that comes from a mammal.
So beef, pork, lamb, even dairy for some people.
All triggered by that one tick bite.
So today we're doing a deep dive into the truly bizarre biochemistry behind this whole thing. Our mission is to figure out how a tick bite turns a common carbohydrate into a deadly allergen. And this is the key, why the reaction is so uniquely and dangerously delayed.
It's a fascinating and, frankly, a growing global health issue. In the U.S., we mostly hear about the Lone Star tick, Amblyomma americanum, and its range is expanding fast across the East and Midwest.
But this isn't just an American problem.
Not at all. We have good research confirming other tick species are causing AGS in Europe, Australia, Asia, South Africa, basically wherever you have that intersection of humans, ticks, and mammals.
Okay, let's tackle the most confusing part for everyone right away, the timeline.
The delay, yeah.
With a typical food allergy, say peanuts, the reaction is immediate. We're talking minutes. With alpha-gal, the symptoms, they don't start for 2 to 6 hours, sometimes even up to 8 hours later.
And that delay is what makes it so incredibly difficult to diagnose.
Yeah.
It completely masks the connection.
Of course.
If someone wakes up at 2 a.m. with a severe allergic reaction, their mind doesn't go to the steak they had for dinner 5 hours ago. That's just not how we're trained to think about food allergies.
So what are the symptoms? What should you actually be on the lookout for?
Well, they can vary wildly, from just, kind of annoying to genuinely life-threatening. You might start with severe itching and hives all over.
What we'd call pruritus.
Right, pruritus. And then it can escalate pretty quickly to dangerous swelling of the lips, the face, the throat. That's angioedema.
And then you get into the respiratory symptoms, which is always the biggest fear.
Absolutely. Wheezing, shortness of breath, a real tightening of the airways. But one of the most clinically misleading things we see is the GI tract involvement.
The stomach issues.
Exactly. Severe stomach pain, nausea, vomiting, diarrhea. And what's so critical for clinicians and patients to understand is that, based on the studies we've seen, a good number of patients present only with GI symptoms.
Without the rash.
Without the telltale hives. And because standard allergy protocols always look for skin involvement, they get misdiagnosed for years with things like IDS or severe acid reflux.
Which brings up this idea of the hidden patient. I was reading that some people who have these frequent, terrifying anaphylactic reactions with no clear cause, they might actually have undiagnosed alpha-gal.
That is the ultimate danger. Anaphylaxis is a true medical emergency: trouble breathing, a fast, weak pulse, feeling dizzy, passing out. It requires epinephrine immediately.
And if you're having those episodes, especially in the middle of the night and no one can find the trigger,
AGS has to be on the table.
Yeah.
That delay hides the connection to dinner every single time.
So once you're diagnosed, what's off the menu? What are the triggers?
Well, the main ones are all red meats from mammals. So beef, pork, lamb, venison, rabbit, even organ meats. But for the most sensitive individuals, it goes further.
To dairy.
To dairy, and also to gelatin, which is, derived from animal collagen.
And gelatin is in everything. Marshmallows, gummy candies, vitamin capsules.
It's a huge challenge. But the good news is you don't have to go completely vegan.
Okay, that's good.
No, thankfully. All poultry, so chicken and turkey, reptile meats, and all seafood, fish, shellfish, they naturally do not contain the alpha-gal molecule. So those are perfectly safe.
All right, let's pivot to the deep science here, because this is the real immunological puzzle. We're always taught that allergies are a reaction to a protein.
And that's the core surprise of AGS. The allergen here isn't a protein. It's a carbohydrate, a sugar molecule called galactose alpha-1-butyl-3 galactose.
We just call it alpha-gal for short.
Thank goodness, yes. And it's an allergy where the immune system becomes hypersensitive to this very specific sugar structure, not a protein antigen. It turns decades of allergy dogma on its head.
So how does this sugar, which millions of people eat every day without a problem, suddenly cause this massive immune system rebellion in one person?
The mechanism is actually quite elegant. So alpha-gal is naturally present in the cells and tissues of almost all mammals.
Except us.
Except for humans, apes, and old world monkeys. We're genetically unique in that We lost the enzyme that produces this sugar millions of years ago. So, the thinking is when a tick feeds on, say, a deer or a cow, it ingests blood containing alpha-gal.
Okay.
And recent research has actually confirmed that the sugar ends up in the tick's salivary glands.
So the tick is just this highly effective, tiny biological syringe. It's just passing the sugar from its last meal into its next victim.
That's a perfect way to put it. It bites a human and injects the alpha-gal into the bloodstream. And since our bodies don't make it, our immune system screams, "For an invader!"
And it mounts a defense.
It mounts a massive defense, creating a flood of specific IgE antibodies designed to do one thing: attack that alpha-gal sugar. And just like that, you're sensitized, you're primed.
And the next time you eat a steak, those IgE antibodies are waiting, and they trigger that whole allergic cascade. But this brings us back to the biggest mystery. Why the 2 to 8 hour delay? Why doesn't it happen right away?
That is the million-dollar question, and it seems to be tied to how our bodies process fat.
Fat, not the sugar itself.
Well, the sugar is embedded in the fat. Unlike a protein allergen, which gets broken down in the stomach and absorbed pretty quickly into the blood, alpha-gal is attached to fat molecules in the meat.
Ah, so the body has to go through the whole long process of digesting the fat first.
Exactly. The alpha-gal isn't absorbed rapidly. It travels all the way to the small intestine, gets packaged into these tiny fat particles called chylomicrons, and then those enter the lymphatic system before they finally hit the general circulation.
And that's when they meet the IgE antibodies.
That's when the reaction kicks off, that whole digestive journey. That's your 2, 4, 6 hour delay right there.
That is genuinely fascinating. The fact that it's fat metabolism, that's the key that unlocks the whole timeline.
It is. And it also helps explain why reactions can be so variable. Not every single exposure causes a reaction. And we know that other factors like maybe intense exercise after a meal or drinking alcohol.
Things that speed up digestion or increase inflammation.
Right. They can potentially affect the timing and the severity of the symptoms.
Given how bizarre all this is, the delay, the GI focus, let's talk about the diagnosis. I saw a statistic that was, well, it was grim.
It's a huge challenge for patients. The research shows that in the U.S., it takes an average of more than 7 years from when symptoms start to get a correct diagnosis.
7 years.
7 years of unexplained, terrifying allergic episodes. It's awful.
What are doctors missing for that long?
They're missing the history. They're not connecting the delayed timeline. The diagnosis really hinges on clinical suspicion, asking the right questions about tick bites, about when the reactions happen, and then confirming it with a very specific blood test.
So not the standard allergy skin prick test?
No, those are notoriously unreliable for AGS. They often come back with false negatives because the allergen is a carbohydrate, not a protein. You need the blood test that specifically looks for IgE antibodies to the alpha-gal sugar. That's the gold standard.
Okay, so beyond food, there's this other massive issue, the medication minefield.
Oh, absolutely. This is a huge complication because alpha-gal comes from mammals. Components like gelatin, lactose, glycerin, magnesium stearate, they are used everywhere as stabilizers or coatings in pills and vaccines.
So you could have a reaction from your pain reliever?
You could.
Yeah.
We've seen severe reactions linked to the cancer drug cetuximab, certain NSAIDs, even blood thinners that are derived from porcine, pig intestine.
What about surgery?
A huge hidden risk. Porcine heart valves, certain types of surgical sutures. They contain mammalian components. It requires incredible vigilance from the patient and their whole medical team.
So management is obviously strict avoidance, but what's the long-term outlook? Is this a life sentence?
Here, finally, we have some really good news.
Okay.
There is significant hope. Unlike a lot of other food allergies, AGS can actually improve or even resolve completely.
Really?
Yes, but there's a big condition. The person has to avoid any more tick bites. If you prevent re-exposure, the body stops getting that trigger, and the IgE antibody levels in the blood will gradually decrease over time.
How long does that take?
It varies. We've seen recovery periods from as short as 8 months to as long as 5 years. But it can happen.
Which makes prevention the single most important piece of advice we can give.
Without a doubt. The best defense is a layered one. First, physical barriers. Long pants tucked into your socks, long sleeves, a hat, especially in wooded or grassy areas.
And use repellent.
Use repellent, DE on your skin, methrin on your clothes and gear. And then, and this is the part people forget, do a thorough tick check and take a shower as soon as you get inside. Ticks can wander around for hours before they attach.
And then if you find one that's attached.
Proper removal is key. Use fine-tip tweezers, get as close to the skin as you can, and pull straight up with steady, even pressure. Don't twist it or crush the body.
So to recap, alpha-gal syndrome. A tick-borne allergy to a sugar, not a protein, that causes a severely delayed, potentially fatal reaction to red meat and other mammalian products.
And if we just zoom out for a second to the broader immunology, there's one last really provocative detail from the research. There's evidence suggesting that your blood type might play a role. Specifically, if you do not have type B or type AB blood, you seem to be at a higher risk for AGS.
Wait, blood type? How does your blood type protect you from an allergy you get from a tick bite?
It's because the B blood group antigen, the molecule on your red blood cells, is structurally very, very similar to the alpha-gal carbohydrate.
So your body's already used to seeing something that looks like alpha-gal.
Exactly. If you're type B or AB, your immune system has a level of pre-existing tolerance to that shape. It's less likely to see the alpha-gal injected by the tick as completely foreign and launch that massive IgE response in the first place. It seems to offer some natural protection.
That is a phenomenal twist, that your basic biology, your blood group, could give you an immunological head start against a tick-borne disease. It really just underscores how interconnected everything is.
It certainly does.
So be vigilant when you're outdoors, check for ticks, and please remember the syndrome. If you or anyone you know is experiencing delayed allergic reactions, especially that severe GI distress hours after eating red meat, alpha-gal is something you absolutely must bring up with an allergist.